How did the poverty sim resonate with you? The poverty simulation resonated with me deeply by highlighting the daily struggles and tough decisions that individuals living in poverty face. It was eye-opening to see how financial constraints can affect every aspect of life, from healthcare to the basic necessities. This experience made me more empathetic and aware of the importance of accessible resources and support systems for those in need. It reinforced the need for a compassionate approach in my future practice, ensuring that I consider all aspects of a patient's care when providing. Did your perception of people living in poverty change? If so, how? My perception of people living in poverty did change because the poverty sim put it in a real reality of what these people face every day of their life. During the poverty sim, you had to make choices whether you wanted to get groceries for the week or if you needed your medication. People also had children they had to leave behind at home to watch themselves due to not being able to afford childcare while they are working. It also stood out to me that there is not a public transportation near these people, then they struggle a lot more worse than people that do have public transportation. It also stood out to me that with public transportation, a lot of people in cities use this that are in poverty versus in Mississippi, there are not a lot of public transportation, and we also have the highest level of poverty. So it really made me think how many people in Mississippi do not get medical care due to the lack of public transportation. What experiences have you had or witnessed related to issues addressed during the exercise or discussion? So I've seen people not receive the proper medical care due to not having the financial means to support them. And for example, I've been in line behind someone at the pharmacy, and when they're told their price of their medication, they have to turn around and not get that medication due to the lack of funds. So in the beginning, to even get the prescription, they have to pay money to see a doctor, which already probably put a financial strain on them already. And then they have to go to the pharmacy to pay for this expensive medication on top of everything else they have to pay for. And so they have to make harsh reality decisions whether to feed their children or feed themselves over their medications. And this really put in reality for me how many people struggle and how hard it is to manage medical problems when you are in poverty. How will these issues and experiences shape your approach to patients' families and patient care? The biggest thing that stood out to me after doing the poverty sim was the amount of resources that are available free of charge that I had no idea even existed. And I think a lot of healthcare people, such as nurses, do not know that these exist. And so I think whenever I work as a nurse, I will do research in the area that I'm going to work at and have resources readily available to help my patients get the medical care they deserve if poverty is an issue. There are even vouchers to help pay for your prescription medication, therapy, counseling, help with utility bills, and much more. And these are vital resources that a lot of every healthcare professional should incorporate in their care for these patients. And during this experience, I noticed that social workers were incredibly beneficial. They play a critical role in connecting individuals and families to essential resources, such as the ones that I mentioned above. And additionally, healthcare professionals like nurses and physicians were vital in also providing care for people in poverty. And one of the significant gaps in interprofessional communication I discovered was the lack of coordination between healthcare providers and social services. For instance, there were instances where medical professionals were not fully aware of the social challenges their patients faced, such as housing instability, food insecurity, which also goes back to why it's also very important to get a good comprehensive health assessment, health history on these patients, because if you never ask the questions, you will never know what these patients are going through. Therefore, you will not be able to provide the proper care due to not giving them the proper resources. And what is one thing you can take away from attending roles and responsibilities? One thing I could take away is how every member of the healthcare team works together as a team, and if you need something and someone has a better expertise in that field, you can ask them and to help give them a better care. All right, that's it.